Exactly the four parts of Medicare that every senior should know, understand, and be able to quickly move through what health plan options are available for. Hey everyone, it's Kelby Hightower, the CEO of Medicare Hub. I'm going to be covering the parts of Medicare that every senior should know about and really understand. I'm going to really dive in. There's four different parts of Medicare: Part A, Part B, Part C, and Part D of Medicare. Part A and Part B, most people understand original Medicare. Part A is hospital, Part B is medical. We have other videos that dive into exactly how Part A and Part B work that I communicate through the entirety of Part A and Part B. I'm not going to go into that today. I want to really talk about the two parts of Medicare, Part C and Part D. Part C is Medicare Advantage plans like HMOs, PPOs. There's different types of Medicare Advantage plans, but HMO and PPO is what most people refer to them as. Those are private insurance companies that are contracted with the federal government or Medicare. They're regulated by Medicare, and there's some rules and regulations I'm going to cover with you in just a second about Medicare Advantage plans. And then Medicare prescription drug plans. Medicare prescription drug plans is what, if you choose to stay on original Medicare, Part A and Part B, and you want drug coverage, you would enroll into a Medicare Advantage plan, a Medicare prescription drug plan, and that would cover your medication cost, and you would have like copay or co-insurance portion, and the plan would pick up the rest. A supplement plan, you would have original Medicare, a Medicare supplement, and then a drug plan. And there's rules and regulations around Medicare Part C and Part D. If you don't choose to enroll into Medicare, there's penalties. If you don't choose to enroll into a prescription drug plan, since 2006, since the Medicare Modernization Act came into full law in 2006 when that transpired, what happens from 2006 up to present is there's a 1% penalty for each recurring month that you do not have a drug plan. So Part B, if you turn it down, you have a 10% penalty annually. But Part D, prescription drug plans, it's a law, it's a regulation. And if you don't choose a drug plan, then you choose to go enroll into one later on and you're past your initial enrollment period or your standardized special election period of choosing a drug plan without a penalty, you're going to have a penalty assessed. So, but laying all that aside, I want to cover some information about exactly kind of the rules, common issues seniors face when enrolling into Medicare Part C plans or Medicare even prescription drug plans. This will apply, and at the end, I'm going to kind of bring this home to prescription drug plans in general, because we hear a lot of educational videos communicating to seniors to stay away from Medicare Part C or Medicare Advantage plans, basically they kind of create like the Part C Medicare Advantage plans are like villains, and the hero of Medicare is a Medicare supplement and a drug plan. In reality is, if you understand how the rules and regulations of Medicare work, Medicare oversights Medicare Advantage, they oversight Medicare prescription drug plans. The Medicare Advantage plans are great if the network is great, and that's what you want. So 50% of the population in America right now enroll into Medicare Advantage plans. The other population account breaks down for Medicare supplements or those that choose to stay on original Medicare, or they have an employer-based retirement plan, they choose to stay on that. So a larger population of people are enrolling into Medicare Advantage plans. Now, sometimes the people that have enrolled into them did so not being guided, not being educated, not being communicated to their different options. They didn't know about Medicare supplements clearly. They didn't understand the Medicare Advantage plans and whether or not you want to call them limitations or how the plan worked. But if, in all honesty, when we communicate to our clients and communicate how the Medicare Advantage plans work, and they understand that, and that's so their choice to enroll into that, then they're happy with those plans. Now, I say this all the time, where there's people, there's problems for everything that we're dealing with Medicare, original Medicare, if you're calling original Medicare, if you're calling your Medicare Advantage carrier, or prescription drug carrier, Medicare supplement carrier. When you're dealing with those people, you're going to have problems because sometimes you're dealing with somebody that just doesn't care. They have a what I call a job, a job, just over broke. They're just there clocking in, clocking out. They can care less about you. Now, for us, we care, and we have a customer service side to our agency. You call in, somebody's going to handhold you and walk you through solving the problem that you have. But for other entities, as far as Medicare in general and all the health plan options, a lot of times you're dealing with people that don't care. And so for me, I want to educate you on the misconceptions about Medicare Advantage, and then just focus a little bit on prescription drug plans. Medicare Advantage plans have networks. So if you're in metro areas or heavy populated areas, or you have access to those areas within a short driving, the networks typically are huge for primary care doctors, specialists, hospitals, all the different Part A and Part B services that you would need, you're going to have access to that. You're not going to be restricted in networks typically. Now, there are plans that don't have great networks, even in metro areas. So then what are some other things? Cost and out-of-pocket expense, just understanding what is my cost going to be enrolling into the plan. Then if I have access to go to the doctor or have a surgery or things like that, what would original Medicare cost me in comparison to what the Medicare Advantage plan would cost? And the greatest thing about Medicare Advantage plans, they're going to cost less than original Medicare because Medicare doesn't have a maximum and Medicare Advantage plans have a max out of pocket, what they call MOOP. And every year the max amount is up to a certain dollar amount. Now, right now that max out of pocket is like $8,850. Most plans max out of pockets range from about $3,500 to $6,000 that we enroll people into across multiple states. So that just means the most out of pocket costs they're going to have for medical or hospital copays or coinsurance is up to that max, and everything above and beyond that the plan covers. So that's important to understand. It's also important to understand you're on the hook for that. So if you like to just pay a premium for a Medicare supplement and then not have any additional cost or maybe a small Part B deductible, you can choose a Medicare supplement. But if you're willing to say, hey, I understand how the Medicare Advantage plan works, I'm interested in that. What are some rules and regulations, Kelby, that protect me when it comes to Medicare's oversight over Part C and Part D plans? Well, a couple of things that are actually great to understand is most Medicare Advantage plans have prescription drug plans built into them called MAPD plans. So if you're wanting a drug benefit and you're not wanting to pay a premium for the prescription drug plan, a lot of times the Medicare Advantage plans have actually better formularies and better prescription drug plan copay costs than a standalone prescription drug plan. I've looked at thousands of plans for years and years, over 17 years of doing this business, and Medicare Advantage plans with drug plans, MAPD plans, a lot of times have very robust and great formularies and very good low costing copays. And you look at a standard prescription drug plan, if they are looking at that option, will have higher cost. That's just how the plans are designed and how the Medicare Advantage plan, because they're paid by, they're contracted with Medicare. Medicare allocates a dollar amount per month to that plan to administer all the Part A, Part B, Part D needs, and then Part C additional benefits are going to be like dental, hearing, vision. So plan changes, you can make plan changes on the enrollment season or now the open enrollment season. There's really about 6 months out of the year you can change at least one time, if not multiple times. And then you have special election periods, which allows you to be able to change if you move. Prior authorizations I'm going to cover in just a second, but some services may require prior authorization, which can lead to delays and denials. Seniors may find the process of getting approvals complex and time consuming. Now, that's going to involve surgeries typically and major hospitalization visits and things like that, getting authorization before you have something done. So typically you're talking to a doctor or a specialist, and they usually are going to put the prior authorization in, and if it's turned down, you can go back to your doctor and they can file an appeal. And I'm going to tell you the steps. This is very important, the steps, and to understand how this works, just in case if you enroll in a Medicare Advantage plans. So let's get into the rules and regulations for Medicare Advantage plans that are important. And these are going to also sometimes apply to Medicare prescription drug plans. So here's the point about drug plans I wanted to make before we get into these regulations. You'll often hear people educate you about Medicare supplements, and they will kind of demonize Medicare Advantage plans, but you never hear anybody demonize prescription drug plans. Prescription drug Part D plans are part of Medicare. They're regulated by Medicare. They're paid by Medicare. You can also offset that because sometimes you're paying a premium, but they are contracted with Medicare just like Medicare Advantage plans, and they're regulated in general regulation like what we just covered about Medicare Advantage plans. Those plans too have restricted formularies, formulary issues. Sometimes you have to get an authorization to go on certain medications. There's quantity limits. There are all these different rules that regulate Part D, but you don't see Part D plans being demonized, where people that are marketing Medicare health plans a lot of times don't understand the Medicare Advantage, or maybe they do a lot of Medicare Advantage enrollments and they demonize Medicare supplements. Well, neither one should be demonized, nor should Part D. Of who's demonizing what, because really you just need to understand how the plans work. And then with Medicare Advantage plans and Part D, this is really important about the rules and regulations. So let's cover those real quick. Hey, most seniors are confused about how to choose the right Medicare health plan. We have got a workshop for you that you can register for below. This is going to walk you through exactly how to choose the right Medicare health plan, how Medicare works, the health plan options, what's going to be the best fit for you, And in less than 30 minutes, we're going to walk you through a workshop that explains exactly how you can choose the right Medicare health plan. Register below. Sometimes you're going to have coverage requirements. And that's just going to be Medicare Advantage plans must cover all services that original Medicare Part A and Part B services cover. So they're contracted with Medicare. The statement they have to be equal to or better than. Typically, Medicare Advantage plans are going to be better than, much better than Medicare, original Medicare. They may also offer additional benefits like dental, hearing, vision. So it's not mandatory, but they can choose, and most of the time they take some of the money allocated to them from the federal government to allocate towards additional benefits like dental. Some of you guys are getting marketed to about getting a $3,000 food allowance card. And guys, if it seems too good to be true, guess what? Typically it is. Typically you're going to have routine dental, comprehensive dental up to a certain dollar amount. It's going to have a decent dental benefit on it. It's going to have allocation for eyeglasses and contact lenses, maybe up to $200 or $300, $150. It's going to have maybe some over-the-counter benefits each quarter, $100, $200. Sometimes for people who Medicare and Medicaid, fixed low-income people are going to qualify for a higher limit because they have different needs. Maximum out of pocket, we talked about that. Uniform premiums and cost share, so all plans must charge the same premium. They can't charge Billy a certain premium and then Susie a different premium. That have to be standardized by the plan. The Medicare Advantage plan submits it every year. The government approves it. That plan is regulated to stay at the premium or the cost share or copay amount for the entire year until they submit changes again, and so on and so on. Quality ratings, all plans now for Medicare Advantage and prescription drug plans, both alike, are rated on a 5-star rating. 5 stars is supposed to mean that the plan performs extremely well, and the lower the stars, the lower the rating. Sometimes new plans have lower ratings. There's all kinds of moving parts about star ratings. We'll talk about that on a different video altogether, but there are star ratings, and we have to let you know about them and send you a copy of the star rating. It's just part of the regulations of what we do. Prior authorization and step therapy, I'm going to cover that in detail, but CMS has guidelines for the use of prior authorization and step therapy for certain services and medications. Plans must follow these guidelines to ensure timely and appropriate access to care. Here's the rule, and here's how it regulates when it comes to you. The plans must follow these guidelines to ensure timely and appropriate access to care. But in general, Medicare is there to ensure the guidelines are done and timely and appropriate access to care is provided to you through Medicare Advantage or prescription drug plans and original Medicare. So people can make mistakes. Let's finish up by going over the grievances and appeals in the Medicare Advantage world. So if you have a Medicare Advantage plan or you're looking at a Medicare Advantage plan, these are important to know about what happens if this happens. So what is a grievance? A grievance is a complaint against. It's a formal complaint about an issue other than a coverage determination. It typically involves problems related to service, quality of care, or how a Medicare Advantage plan operates. Common reasons for filing a grievance is like the quality of care you receive. You go to the doctor's held accountable by the Medicare Advantage carrier to provide you a certain quality of care. So if your doctor's rude, the staff's rude, they leave you sitting in the waiting room for 2 hours, that's unacceptable to Medicare, and it's unacceptable to the Medicare Advantage carrier. Problems with the behavior or actions of healthcare providers and staff, again, difficulty in getting timely appointments or services. Hey, we can't see you for 2 years. That's unacceptable. But Medicare standards, there's regulations that regulate when you can get in, when you can be seen, and how long it takes you to get through the door and get into the doctor, and from the waiting room to seeing the doctor or the nurse practitioner or whoever you're seeing. Disagreements with the plan, way the plan processes claims or handles customer service. If you've had a bad customer service experience, guess what? You can file a grievance, and you should. The plan is required to respond to standard grievances within 30 days. If the issue involves a delay in providing health services, the plan must respond within 24 hours. So depending on what the grievance is, hey, I'm complaining against this person, it's 30 days. Hey, I'm not getting service from the plan, it's within 24 hours. Appeals, what is an appeal? An appeal is a request for the plan to reconsider a decision made about the healthcare services or payment. It usually involves situations where the coverage for a service, treatment, or item has been denied, reduced, or terminated. Types of appeals are standard, expedited, and I wanted to talk about, the standard appeal is going to take 30 days for services request and within 60 days for payment requests. Expedited or fast appeals are going to happen within 72 hours. So you can make an expedited appeal. Let's say you're going to have a surgery and it's scheduled for 2 weeks and they've turned it down. You can make an expedited appeal because you need to know if this plan is going to cover my surgery. Now, if they turn it down, here's the great thing about the process for filing appeals. You have an initial decision by the organization. The second one is called a level 1 appeal, which means it's reconsidered by the plan. And then beyond this, it goes to an independent review at level 2 appeals. So what's called as a qualified independent contractor actually reviews, determines, hey, you've got to do the surgery, move on. The doctor's got approval. You need to approve this and get it done. That's called a level 2 appeal. If they don't do that, it goes to the Office of Medicare Hearing and Appeals. So from level 3, 4, and 5, you're dealing with Office of Medicare Hearings and Appeals, the Medicare Appeals Council at level 4 appeal, and then level 5 is called the Federal District Court. So the final level of appeal involves taking the case to the Federal District Court, providing the amount in dispute meets the minimum threshold. So why is that important? Well, there's different levels, and I always say that each level, that if they turn you down, which typically they're not going to do that, if they turn you down and you appeal it, it's going up to a higher level. And the closer it gets to when you start using the word federal or government or House of Medicare Hearing Appeals from level 3 and beyond, what happens is all of a sudden it becomes a Medicare issue that they're all of a sudden aware of, and then they're going to come down on the star ratings on that plan. But you need to be aware that Medicare Advantage plans are governed by the federal government, and the closer to a problem you continue to push and take these steps allows it to get closer to Medicare, and Medicare will regulate, and they're going to adhere to supporting the Medicare beneficiary. Guys, you need to be educated about your health plan options. You need to realize Medicare has 4 different parts: Part A, Part B, Part C, and Part D. Part C and Part D of Medicare Advantage prescription drug plans can be great if you know the limitations of them. Medicare is great, but you need to know the limitations of them. Medicare supplements are great, but you need to know the limitations of them. And everything has limits. Everything has people touching those plans and administrating everything, and where there's people, there's problems. Guys, stick around. I'm going to be telling you about what we're going to talk about next week. Be back in just a second. Guess what? Next video, I'm going to be covering exactly the high-risk items of Medicare that can create the highest cost for people, regardless of what plan you so choose. Make sure to check out that video. I'll see you on the other side.